personality disorder is a mental health condition that affects the way a person thinks, feels, and behaves. It's important to note that we all have different personality traits, but when these traits become rigid and inflexible, causing significant distress and impairing daily functioning, it may indicate a personality disorder. Now let's talk about the key features or presentation of a personality disorder. People with this often have difficulties in various areas of their lives, such as relationships, work, and self-identity. They may struggle with managing emotions, handling stress, and maintaining stable relationships. Here are some common features. 1. Patterns of thinking and perceiving. Individuals with a personality disorder may have distorted or rigid ways of thinking about themselves and others. They may have difficulties understanding other people's perspectives and may struggle with empathy. 2. Emotional instability. People with this disorder may experience intense and unstable emotions. Their moods can fluctuate rapidly, leading to a roller coaster of feelings. This emotional instability can make it challenging for them to regulate their emotions effectively. 3. Impulsive behaviour. They may engage in impulsive and reckless behaviour without considering the consequences. This can include things like substance abuse, gambling, reckless driving, or promiscuous sexual behaviour. 4. Difficulties in relationships. Maintaining stable and healthy relationships can be challenging for someone with a personality disorder. They may have difficulties trusting others, fear abandonment, and have a tendency to push people away. 5. Distorted self-image. People with this disorder often have an unstable sense of self. They may struggle with self-esteem, have an exaggerated or fluctuating self-image, and feel a sense of emptiness or identity confusion. It's important to remember that each personality disorder has its own specific features and diagnostic criteria. It's always best to consult with a mental health professional for a proper diagnosis and treatment. Now let's talk about what could happen if someone has an extreme personality disorder. This can significantly impact a person's life and well-being. They may struggle to maintain stable relationships, have difficulties in academic or professional settings, and experience emotional turmoil and distress. In some cases, extreme personality disorders can lead to self-destructive behaviours, such as harming or very negative thoughts. However, it's essential to note that with appropriate treatment and support, individuals with personality disorders can experience significant improvement in their symptoms and overall functioning. Therapy, medication, and developing healthy coping mechanisms can help individuals manage their condition and lead fulfilling lives. There are several types of personality disorders, each with its own unique characteristics. Here are some of the most common ones. 1. Borderline personality disorder, BPD. People with BPD often struggle with intense emotions, unstable relationships, and impulsive behaviour. They may have a fear of abandonment, engage in self-harming behaviours, and experience chronic feelings of emptiness. 2. Narcissistic personality disorder, NPD. Individuals with NPD have an inflated sense of self-importance and a deep need for admiration. They may exhibit a lack of empathy towards others, have a sense of entitlement, and constantly seek attention and praise. 3. Antisocial personality disorder, ASPD. ASPD is characterized by a disregard for others' rights and a lack of empathy. People with ASPD may engage in manipulative and deceitful behavior, show no remorse for their actions, and have a history of disregarding societal norms. 4. Avoidant personality disorder, AVPD. Those with AVPD have an intense fear of rejection, leading them to avoid social situations and relationships. They may have low self-esteem, be extremely sensitive to criticism, and feel socially inept. 5. Obsessive-compulsive personality disorder, OCPD. OCPD involves a preoccupation with orderliness, perfectionism, and control. Individuals with OCPD may have rigid thinking patterns, an excessive focus on rules and details, and a strong need for order. These are just a few examples, and there are other types of personality disorders as well. It's important to note that a person can have traits from multiple personality disorders, and the diagnosis can be complex. When someone has an extreme personality disorder, the impact can be significant. They may struggle to maintain stable relationships, experience difficulties at work or school, and have challenges in managing daily life tasks. Extreme personality disorders can lead to feelings of isolation, loneliness, and intense emotional distress. In some cases, individuals with extreme personality disorders may engage in self-destructive behaviours or have thoughts of self-harm or suicide. However, it's crucial to remember that with proper treatment and support, individuals with personality disorders can experience improvement in their symptoms and quality of life. Therapy, such as dialectical behaviour therapy, DBT, or cognitive behavioural therapy, CBT, can help individuals learn coping skills, regulate emotions, and develop healthier relationship patterns. Medication may also be prescribed to manage specific symptoms or co-occurring mental health conditions.